afternoon. Good afternoon, everyone. We're having folks join us, so I'm going to probably repeat myself a couple of times and welcome you all. But my name is Larry Resendez. I am Vice President of Student Services, and we are excited to have you. We're going to take a couple minutes, though, before we get started, just to let everyone come into the room. But welcome. Good afternoon, everyone. If there are some that have just joined and didn't hear, I am Dr. Larry Resendez, Vice President of Student Services here at Mission College. Thank you so much for being here this afternoon. We have a great presentation ahead. It's nice to see so many familiar faces and some people I haven't seen, but we welcome you, and we're still going to give it a few more minutes as I see people are trickling in. We did have over 140 folks register, and we're about half of that. So want to be respectful of those that have registered and give folks a little bit more time. So bear with us, but we'll get started shortly.
Get a more colorful background here.
That's nice. I like that, Dr. Norris. Very nice.
And still very true to the brand colors too.
Yeah,
that's true.
I'm trying to do my job here.
We see it. I'm sure Tyler recognized it.
I appreciate that.
All right, we're climbing up. We're about 80 folks. I know there's more that are going to join us. Dr. Norris reminded me we're in a pandemic and we need to be patient and give folks opportunities to join us as they can. But I also want to be respectful of all of your time and also our presentation as well. So why don't we do this? I'm going to go ahead and kick things off and just say a couple things before I turn it over to Dr. Norris. First and foremost, I want to say to all of you, I hope that you're safe and healthy. I know it's been an incredibly challenging time, and our hearts go out to you and your families, and we just pray that everything's going okay for you right now. I also want to mention that our college president, Dr. Monte Perez, is unable to make it. He sends his regards, however, and his regrets for not being able to make it. If he could have been here, he certainly would, but he has a very important issue that he's taking care of at home. So wanted you to know that. I want to thank all of the Mission College faculty, staff, all the students, anyone from the community that's here to join us. This is such an important issue, and we were very fortunate to know that Dr. Keith Norris is someone that resides close to us and is an expert when it comes to the vaccine, COVID-19, and I'm going to take just a couple moments to introduce him because it's really great to have him here. So I first want to welcome him very much today. So let me go ahead and share a few things about Dr. Norris. He is the Executive Vice Chair for Equity, Diversity, and Inclusion in the UCLA Department of Medicine. He co-leads the Community Engagement Research Program for the UCLA Clinical and Translational Science Institute and the NIH-funded COVID-19 California Alliance. It's a network of over 70 community and 11 academic partnerships across the state to improve COVID-19 knowledge and increase the participation of underrepresented populations in COVID-19 prevention, therapeutic trials, and uptake of approved vaccines. Please join me in welcoming Dr. Keith Norris.
Thank you very much. It's a pleasure to be here, and to the Los Angeles Mission College community. Not only thank you for having me here, but I think you should give a big round of applause and a hand to the leadership for reaching out to make sure that there's information available to you to help you make the best decisions you need to make for you and your family and your loved ones when it comes to considering whether or not you might want to take a vaccine for COVID-19 to prevent the COVID infection. So what I thought I would do is spend a few minutes just giving an overview and then spend most of the time for Q&A and discussion. So one question we hear a lot of, why are communities of color being encouraged to get the vaccine when usually they're being excluded and not able to be connected to health issues? And the main reason is that the hospitalization and death rates are 2 to 4 times higher, right? And so we really want to, so given that understanding, we want to figure out how we can have an impact and stop this high rate of hospitalization and death in communities of color. And these are just some pictures from Martin Luther King Jr. Hospital back in probably January, when there was so many admissions, they had to open up this sort of makeshift tent area outside, and they also had to use the gift shop and other little spaces in the hospital for taking care of patients. Fortunately, the surge has passed and things are getting better, but it's not over yet. So these are just some quotes. Our group does a lot of focus groups and town hall meetings and things of that nature. And these are just some quotes. The US has never been 100% pro-Black, so why are we getting preferential treatment for a vaccine now? What phase is the undocumented in? It kills me every time I see my Lola and don't hug her and don't come near her and don't let her pinch my belly. I see myself super disrespectful, okay? If the Lola tells everyone to get it, they're all getting it. For people who would have been let down by the system in the past, I hope there is a little bit of compassion, understanding, and patience, and not treating someone as less than because they are impacted by past situations. And then from one of our Pacific Islander participants, the other concern is the long-term effects and not sampling enough Pacific Islanders, women, those of color with health disparities. The vaccine, the time frame for creating the vaccine is pretty quick, and that's pretty scary, and that's the word that's going across the coconut wireless fine. So these are just some quotes and some reflections from different individuals in many of our communities of color. So the concerns: 1, mistrust based on both historic and contemporary mistreatment. The lack of a universal trusted source of information. So there's different sources of information, there's inconsistent information, people getting information from lots of different places, and who knows what to trust. The vaccine is fairly new, it was created quickly, and there's concerns with part of the process skipped. And then were people like me part of the clinical trials, right? So there are many reasons for vaccine deliberation, and these deliberations in many instances are very valid, respected, and should be answered by a qualified physician or agency. Hopefully I might be able to have some input to some of those today. But what I hope to do is to dismiss and what I would consider misinformation or disinformation, those things that are like not anywhere near true. Right? So why consider taking a vaccine? Again, this vaccine was developed because millions of people were being infected and then hospitalized and dying. Okay? And right now we have 3 approved vaccines, and they are all great at preventing COVID-19 hospitalizations and COVID-19 deaths, right? So that's the key. They are all great and appear to be pretty similar for that. And we'll come back. I know there's been a lot of talk about, is the J&J vaccine as effective as the other 2? There's numbers that have been thrown around, and we can talk more about that. But when it comes to these 2 things, the J&J is just as good, okay? And at the end of the day, we want to protect our communities. So what is not a thing? The vaccines do not alter our DNA. That is not a thing. 5G phone cannot transmit the coronavirus. That is not a thing. Results weren't faked. You cannot get COVID from the vaccine. So there are vaccines that use an actual virus that's been sort of made weakened to create antibodies. But if someone's already sick and they have this weakened virus, that weakened virus could then cause infections. And so there are vaccines that can give a person that infection. The COVID vaccines are not one of them, at least none of the ones that are available here in the United States. You cannot get COVID from the vaccine. How does it work? You get an injection in your body. It transmits either the messenger RNA or a virus. It goes into your cell and it teaches your body how to recognize a certain portion, a spike protein on the virus, and then it disappears like Snapchat. So now your body is making this immune response. And so when you get the vaccine, you may have side effects because it's having this immune response and getting everything geared up. But the hope is that if you then come in contact with the virus, your body is ready to fight it and either fight it off so you don't get it, or if you get it, keep it from becoming really bad. Okay. There are no nanosensors to monitor your location. I know there's been a lot of stuff about nanosensors, government monitoring people. Everybody has a smartphone. If you have a smartphone, people can monitor where you are. If you're really worried about being monitored, worry about your smartphone. Don't worry about the vaccine. The good news is there are no long-term side effects to date from the vaccine. So there are short-term side effects, and we'll talk about those, but there are no long-term side effects that we know of to date. So we're promoting the vaccine to try to help, reduce the serious complications that are happening across the country, but even more so in communities of color. Now, what we see in from the original studies, the Pfizer Moderna vaccines are 95% effective in preventing any symptoms of COVID. J&J was 85% effective in preventing severe COVID, 66% effective in preventing any symptoms, but it's greater than 95% effective in preventing hospitalizations or death. So in the actual study, not one study participant who received the J&J vaccine was hospitalized or died. Not one. So we're not thinking anything's 100%, so we're thinking it's at least 95% like Pfizer and Moderna, right? So all three prevent hospitalizations and death, and that's what we want to do. It's also important to note that flu vaccines are about 40 to 60% effective. So these are really, really effective, okay? And we'll talk a little bit more about what might happen if you then get COVID and the potential long-term complications of having had a COVID infection. I just want to say that the technology in these viruses, so people talk about this being done very quickly. On one hand, it was done quickly, but the technology that's being used has been under investigation for 20 to 30 years and was used for other coronaviruses, but MERS and SARS, but those infections, those sort of epidemics died out before it was really a need for the vaccine. So a lot of it had been worked at in the past, and now it was available to be sort of shifted to create these vaccines quickly. So this compares some of the side effects of the flu vaccine, the shingles vaccine, and then in the middle, Moderna, Pfizer, and J&J. So the flu vaccine has the fewest amount of side effects, followed by J&J, Pfizer, Moderna, and then actual worst is shingles vaccine. So I actually had the Moderna. I was fortunate. I only had some soreness at the injection site. but I know other people who have had headaches, fever, chills. So a lot of times with any of these, at least the flu and the COVID vaccines, some of the side effects are you feel like you have a flu. And so people feel sick, they have a fever, they have aches and pains and chills, and that happens. The shingles vaccine is supposed to be the worst of them all. I'm supposed to be getting my shingles vaccine soon. I'll see. I didn't see the slide before I knew about it, so now I have to think it over, but I guess I'll have to do it. That's for older people, so most people on this call don't have to worry about that. So again, which vaccine is better? Whichever one is available for you, right? So they all three what's really important is to reduce your risk of getting very, very sick. What we're trying to do, we have our group, we have this large research project across the state, and we work with the state governor's office and trying to make sure every site that has a vaccine available has several choices so that people can make their own choice. Right? We don't want people to feel as if they're being given a particular vaccine without a choice. The J&J, as I said, I got Moderna. My sister got J&J. And J&J is only one shot. And so a lot of people like that. And but it wasn't available when I got my vaccination. So sometimes you can choose, but there may not be all three available. But even, you may be at a site to get your vaccine. By the time you get up there to get it, one of them may be gone out. And so you may only have one choice left, right? So here, the sort of differences between the vaccines: Pfizer is 2 doses, 3 weeks apart. Moderna's 4 weeks apart, and J&J or Janssen is 1 dose. Only the Pfizer has been studied for individuals under 18 years. That's going down to 16 years of age. And so there are individuals, and some children in high school could potentially get the Pfizer vaccine, and that's being looked at as schools are opening up. The studies are just starting now for children, adolescents under 16 years of age. And when you get the vaccine, it usually takes about 2 to 3 weeks after the vaccine, maybe even 4 weeks, to have built up total immunity. So even after the vaccine, we don't want you running around without a mask and washing your hands and everything else. We'll talk about that. But your total immunity can take a few weeks after your shot. There are all sorts of people who look like everybody on this Zoom who participated in the trials, and that's really great. And what we found was, what the study investigators found was, the effectiveness and safety was just as good in participants of color as it was in their white peers, white non-Hispanic peers. And it was also effective in people over 65 years of age and people who have maybe diabetes, high blood pressure, other medical problems. So should you get the vaccine even if you've had COVID-19? Yes, you should. And that's because the antibody response from the vaccine is much stronger than what we've seen right now with the antibody response from having the COVID infection. And so if you've had the COVID infection, maybe 6 months, 9 months later, we see people getting infected again. It also appears that higher antibody response from the COVID vaccine will give you more protection against these new variants that we hear. So we hear about these variants that can be very dangerous. And so having the vaccine gives you more protection against those variants. Should you wear a mask afterwards? Yes. Not so much because you're likely to get COVID, although there's still a risk you could get COVID, but again, unlikely you get very severe COVID, but still a risk. But you could get COVID and have a mild or no symptoms of case of mild or no symptoms of COVID, and then give it to somebody else, right? And so we really want to make sure everybody continues to wear a mask, unless you're in a group setting where everybody's had the vaccine, then it's probably okay. So again, against these new mutations, it appears that the vaccines give a stronger antibody response and give us some protection against the new mutations. And that may be why the J&J results were sort of 66% for getting any type of COVID, rather than 95% we saw for Pfizer and Moderna, because Pfizer and Moderna were done many months ago before the new variants came out. J&J was done in many sites with the new variants. And so with the new variants, you may get infection, but there was enough protection that people did not get hospitalized or die. And so that's the good thing that we found out. And that appears to be the same with Pfizer and Moderna. The other thing that comes up a lot is how much does it cost? We pay taxes. Taxpayers' dollars went into making this. It should be free. Right? They may ask you information for your insurance, and that's because they will bill the insurance company to help offset some of the costs. You should not be billed extra money from your insurance. You should not be paying money to any site. You know, your cousin's friend has a spot where you can get vaccines and it's only going to cost you $50. Don't do it. It's not a thing, right? So what are the risks of infection and risks of vaccine? So for every million cases of a COVID-19 infection, 15,000 people have died and 70,000 were hospitalized. For every million COVID vaccinations, there have been 2 to 3 serious reactions with 1 to 2 hospitalizations. And then there are 1 to 2 potential deaths related to the vaccination that have been under investigation, right? So we're looking at 1 to 2 possible deaths for every million vaccinations, 15,000 deaths and 70,000 hospitalizations for every million infections. So that's the scale that you might think about when sort of weighing the risk. The other thing is, if you get COVID-19, we're finding maybe 1 in 5 people have long-term medical complications from having it. And that could include inflammation around the heart. And we see this picture in the bottom left of this University of Miami basketball player who passed out, collapsed on the court, and fortunately did okay, but he had COVID and he had inflammation around the heart. There could be muscle aches and pains, joint aches, and then there appears to be problems with people's memory, right? And being able to think straight, and being able to concentrate. So those are things that we can avoid if we create our antibodies via the vaccination versus creating our antibodies via getting the COVID infection. So the key takeaways, there's lots of misinformation, particularly in social media, word of mouth, lots of misinformation on mainstream media too, right? So we watch that. COVID doesn't care what any of us believe at the end of the day. Doesn't care what you believe, doesn't care what I believe. If it has the opportunity to infect you, it'll be happy. Communities of color are getting COVID infections at higher rates and dying at higher rates. So it would be important to make sure our communities do everything we can to help mitigate this serious infection. The side effects of COVID-19 disease appears to be far, far worse than the side effects of the vaccine. And for people who have mistrust, and I understand the mistrust and I respect the mistrust, why would I recommend you take the vaccine? Because we want you to stay alive today so you can fight mistrust tomorrow. So that's my message. And during this presentation, it's a little better, maybe 50 to 100 Americans will have died during this presentation today, and another 250 to 500 will be hospitalized while we're having another presentation and thinking about whether or not we all want to take the vaccine or at least get information to be able to talk to friends and family members who may be deliberating, and we want to help to encourage them to take the vaccine. So again, the 3 vaccines are similar in preventing hospitalizations and deaths, which is why we're here today. Because if this infection was not causing hospitalizations and deaths, schools wouldn't be closed down, businesses wouldn't be closed down, they'd probably work on a vaccine, but it would just be like another flu kind of. It's not. People are actually being hospitalized and dying. So that's why we're here today. And so we're fortunate now we do now have some options to protect our communities. And I'll stop there so we can go to some questions.
Thank you, Dr. Norris.
Or
so
answers.
much.
You know, we're open to answers too.
Yeah. Thank you so much, Dr. Norris. I know we do have some pre-submitted questions. We may want to start there. And Alejandro, maybe you can kick us off, and then we'll go through. I see that there are several questions that have come in the chat. And as you guys feel compelled, you can also add them to the chat. Just put question in bold or uppercase so we can see it's a question.
Okay. So, should I read it or someone?
Sure. Feel free, Dr. Norris.
Okay. I've tested positive for COVID in December and had my first vaccine, Pfizer, in March. That's great, right? So we said if you test positive, we want to wait until after you're after you've, the infection's gone away, you're through quarantine, and then then you're eligible after that, and you should hopefully get it within the next 3 months after that. So do I still need to get the second dose? And if so, will I be 100% protected? So yes, you still need to get the second dose, and you will be very protected. So nothing's 100% in life, right? We have antibiotics and medicine for everything. Nothing's 100%. But so far, what we've seen is, you're pretty much close to 100% from being protected for hospitalization or from dying from COVID-19. Right? If I get the second vaccine, should I expect severe side effects? Hard to say. So what we also see is the side effects tend to be worse with the second vaccination than the first one. Why is that? After the first vaccination, now your body has been given the vaccine and is creating these antibodies to help fight off the COVID infection. With the second vaccination, your body now has a much more powerful immune system. And so it will have a more exaggerated or heightened response to the second vaccine. And so a lot of people will have more severe side effects. My side effects were the same with the first and second. My cousin, he thought he had COVID after the second vaccine. He was sick in bed for like 36 hours. And his wife was taking him chicken noodle soup, et cetera, et cetera. And then after that, he was fine. So it can be very variable. Yeah, and I can understand, for someone who unfortunately both had COVID and then had side effects of the first vaccine, getting the second one is even more concerning. So in general, I would say if you've had COVID before and now you get a vaccine, that might be even more of a reason to consider the J&J, where you only have to get one vaccine and therefore only have to worry about going through potential side effects one time. Okay. So it doesn't 100% prevent us from getting COVID, but what we've seen is for every 100 people who are exposed to the COVID vaccination, who are exposed to the COVID virus, if let's say 200 people are exposed to the COVID virus and 100 people actually come down with a COVID infection, who didn't get the vaccine, for 200 people who are exposed who did get the vaccine, instead of 100 people coming down with the COVID virus, maybe 5 or 10 come down with the COVID virus. But instead of 1 or 2 being hospitalized and 4 or 5 dying who didn't get the vaccine, nobody's hospitalized, and nobody died who did get the vaccine. So it is not 100%. You still could get it, but your chance of getting is much less. And if you get it, it's going to be much less severe, right? So that's why we want people to get it. Is it mandatory to get the vaccine? No, it is not mandatory right now to get the vaccine. It is highly encouraged or recommended, but it is not mandatory. I'm currently eligible to get the vaccine, but I'm a little concerned because I'm allergic to penicillin. And I don't know how my body will react to it. What do you recommend? So probably the allergy to penicillin is probably a different allergy than it is to the COVID vaccine, but it does mean your body maybe is more likely to have an allergic reaction, right? So my sister has allergic reactions to different fruits, and she gets severe reaction. She needs the epinephrine pen, the EpiPen. So she, to reduce her risk, she took the J&J vaccine because A, she only had to be vaccinated once, and B, there appeared to be less of the severe allergic reactions during the J&J study. So one is, there are different places you can get the vaccination. If you've had allergies before, want to make sure that there's people there, that there are health professionals there with epinephrine in case you have a very bad reaction. And my bias would be, so a lot of times you can have a vaccination, not have an allergic response, and then the second time have an allergic response. So just like penicillin, a lot of people can take penicillin over and over and over again, and then all of a sudden have an allergic response. So with the J&J vaccine, it's only one time, and that cuts your exposure down. And so that's something I would recommend for someone who's very concerned about allergies. And again, for people who have had COVID, they should be vaccinated. For someone who has not had COVID and gets the vaccine, how long after the vaccine are they safe from getting COVID, and how long does the shot last? So that level of immunity probably takes at least 2 weeks after your second shot for Moderna and Pfizer, and 2 to 4 weeks after the J&J shot. After that, your chance of getting COVID is dramatically less. How long does it last? We're still not sure. So it looks like it should last at least a year. Hopefully it'll last longer, could last a couple years possibly. What may happen is with these different variants, there may be boosters available that help your body develop antibodies specific for the variants. And so that's an option, but that's being examined right now, but we don't really know for certain. Now, can someone naturally have an immune system against COVID? Yeah, so some people, right? So a lot of people may be exposed to COVID and not come down with it. Or some people are exposed to COVID and they have very mild case, just like the flu or cold. And other people get exposed to it and they're in the hospital in the intensive care unit on a ventilator. So we don't know why some people end up in one category or another. And because of that, that's why we sort of tend to recommend the vaccine for anybody who is open to taking it. Okay, let's see, we have in the chat here.
Lots of questions, Dr. Norris. So let's start tackling a few of these. There was one that I wanted to look at with you. It's a point of clarification. It says, what is and is not a thing? And by a thing, are we referring to what is and what is not true?
Correct.
Okay.
So is what is and what is not true.
Okay.
Right. So we see these things or bits of information being posted in the internet, on Facebook, and all sorts of stuff like that. It is not true. It is not a thing.
I'll keep going, and Alejandro, feel free. I have one here. How would we know about any long-term effects when we don't have any long-term data?
So we actually do have, right? So the vaccines, so we have 100,000 people who are in the studies. And so what we have is several months follow-up from those people who received the vaccine. And now, so when the vaccine became approved and people started taking it, we don't have a lot of long-term follow-up from there. But we do have long-term follow-up from the nearly 100,000 people who are in the vaccine trials. And from there, that's where we have data knowing that we don't have the long-term side effects, at least to date. Now, something we need to continue to follow, but what we do know is that we have long-term side effects from people who've had COVID infection.
Thank you.
Mm-hmm.
Alejandro, do you want to?
Yeah, let's see. Another question. It says, what are the major body functions that were tested or not tested to get these vaccines released? What testing still needs to be done for FDA approval?
So the main things that are tested are immune function, inflammatory function. They look at blood tests to see if certain enzymes go up, things of that nature. For the FDA approval, right? So what we have is emergency approval, not the full approval. And what's going to be required for that is more data on long-term follow-up, right? So when we do the studies, we have, we have to statistically look at the differences in people who did and didn't get the vaccine to see if there are differences in clinical symptoms, right? So if we look at side effects, right, we want to know, are these kind of side effects or long-term effects, are we seeing them in people who did get the vaccine and people who didn't get the vaccine? Are they similar? Are they different? Are there any at all? And so that's really the clinical data that the FDA requires typically before it does a full approval.
All right. And someone asked, will the presentation be available to students? So yes, we will be posting, this presentation is being recorded, and we will be posting that video to the college's YouTube channel. So stay tuned for that. We will be publishing a video of this presentation. And then we have a question regarding, is the Russian vaccine safe? My mom lives in Mexico and doesn't trust it.
I'm not as familiar with the Russian vaccine. So I've seen some studies on it. I've seen some papers on it. I was very concerned early on because there was not a lot of transparency about the data with it. So I'm not as familiar with that. And I have some friends of mine in Mexico who I talked to, and they've been doing some deliberations. They're going to be coming to the United States to get it. They're US citizens, so it's easy for them to do that, although they're living in Mexico. But yeah, I don't know as much about that, so I will defer on that one.
And I have one. What about mothers who are personally planning on a pregnancy? Is it okay to get vaccinated now? I've heard pregnant women, or if you're planning on it, should not take it.
So, great question, right? So again, when these studies are done, they typically exclude women who are pregnant or planning to become pregnant. That being said, things happen. It's a pandemic, right? So it's a pandemic and people are getting the vaccines. And so there are actually a fair number of women who became pregnant during the trials. And what we've seen so far is no side effects or adverse effects in women who received the vaccine. They got the vaccine and they got pregnant, so that meant it didn't interfere with their pregnancy. the vaccine, because the mother now has antibodies, those antibodies can get passed on to the baby. So it can help protect the baby. What we do know, though, for women who are pregnant who get COVID infection, the infection is even worse, right? So they tend to have worse outcomes and more likely to be hospitalized or die. So because of that, my recommendation is usually that a person should take it if they're pregnant or planning to become pregnant, because we haven't seen any adverse effects from the vaccine in pregnancy. And we do know that the COVID infection is even worse in women who become pregnant, and that if one gets the vaccine, then those antibodies can be passed on to the baby and help protect the baby. So that's the consensus recommendation right now.
Okay, let's see. We have another one. If you have another sickness, such as a small cold, should you wait to get the vaccine? If I did get the vaccine, what could this do?
Yeah, so if you're sick and you think you have the cold or the flu, you don't have COVID, you have some other medical condition, you have diabetes and your sugar's high or high blood pressure, or you're on some medication for some other condition, we want you to be is in your best health of whatever your best health is, right? Because you're going to get the injection for the vaccine, and now your body has to generate this immune response. And so we want your body to be able to generate the best immune response it can generate. If it doesn't, it's not like bad or terrible, right? So you're not going to get, some other problem per se, but you may not get the most effective immune response that you could get. And so that's why we want you to be in good health. Or if you're not, and plus if you're not in good health, and then you get the injection and you get the immune response, and then you get side effects, then that's like even worse and more of a drag if you're getting all that going on and you're not in your best health. So we want you to be in your best health possible when you get the vaccine.
And I've got one for you, Dr. Norris. I've been told to take the vaccine after 2 weeks of COVID infection. Is the rule of thumb to wait 2 weeks or 90 days? Is there a risk to getting it sooner than the 90-day mark?
Right. Another great question. So what we want people to do, right? So after the infection, if you've had COVID infection and then you've done quarantine and you're clear now, you're not eligible to get the vaccine. So you can get it then. So there's no risk in getting it sooner than the 90 days. The recommendation is to get it within at least 90 days. And that's because the antibodies tend to go down over time. And at 90 days, we think that by 90 days, in some people, they will have gone down low enough that they could be at risk for getting the infection again. Now, some people have COVID infection and maybe their antibodies may last for 6 months, 9 months or longer. We don't know. But we don't really check the antibodies to see what your antibody level is, whether or not you should get a vaccine. It's just easier to say, within 3 months, get your vaccine. But it's okay once you've passed, about 2 weeks is not bad, right? If you've been quarantined, once you're over the COVID infection, now you can go ahead and get your vaccine, but you don't have to get it right away. But you should get at least within 90 days.
All right, we have a bit of a technical question here. It says, what do you think about the D614G, which is responsible for spikes? There are claims about if this mutation happens, vaccines may not be useful.
So, yeah, there are a variety of different mutations that can lead to a situation where the virus will be potentially less or even not responsive to the antibodies that would be developed from the present vaccines. And a lot of times, so we have these different mutations coming up. We have the UK variant we hear about, the Brazilian, the South African, there's California and other states have their variants. Right now, so usually what the companies do is they do some lab studies to see if there's still effectiveness. But for right now, it appears that most of the variants that are out there, at least, are responsive to the vaccines. They may not be as responsive as so those variants may not, the vaccine may not totally prevent one from getting COVID with those variants, but right now they appear to prevent like the severe infection. So the Jnj Vaccine Study was done in South Africa, part of it. So it was done in multiple countries. South Africa was one of them. And with the South African variant, which is very serious, for the AstraZeneca vaccine, they had to stop the AstraZeneca vaccine study in South Africa because it was not preventing severe infections with the South African variant. But the J&J vaccine did prevent severe infection. So it continued on and is now being approved. So it'll be a combination of the types of vaccine and the type of variants and us trying to figure out what's going to work best as we go forward. So it's kind of flowing, kind of moving. And hopefully we will have a situation where at least we should have solid vaccines that can, if not prevent the infection completely, prevent us from being hospitalized or dying, right? For me, if I get sick with any virus, and I'm home and I feel crappy for a couple days, so be it. I just don't want to be in a hospital on a ventilator. If I die, I probably don't want to die, but by then I'd be dead. I would probably, but right now, I'd like to stay around a little longer. That's up to God.
I have one for you here, Dr. Norris. I tested positive for COVID-19 on Christmas 2020, and I tested negative 2 weeks later. I lost my taste and smell and still do not have it back. I'm getting worried at this point. What can I do to get my taste and smell back?
So sorry to hear that. We don't, right now, we don't have anything that we know of that can reverse those side effects. What we are seeing in most people is that after 3 or 6 months, they tend to go away, right? So we have these symptoms that last for many months, but we are seeing them get better over time. We don't know for certain. We don't know for certain if there may be some that never get better, but what we are seeing is that they're getting better over time. So again, we've only been, it hasn't even been a year yet. So we're following people who have side effects from COVID that are persisting. The good news is we are seeing them get better over time, but how long we really can't tell. But if it's just Christmas, yeah, I'd hope it should be coming back soon, but it still could be a few months.
All right, and then we have a question again regarding how long the effects of the vaccine last. Is the vaccine a one-time doing, or after a certain amount of time, does it have to be repeated, or much like the flu where it's once a year?
Yeah, so that's a great question. And actually there's one, maybe two companies that are looking to combine the flu and the COVID vaccine into one shot, right? So you can get it once a year, one shot. I originally thought that we'd probably have to have the COVID vaccine every year, just based on what it looked like the antibody response was from people getting COVID infection. But now that it appears the antibody response from the COVID vaccine is so much greater than the COVID infection, I am cautiously optimistic that it could be every 2 or 3 years, right? But again, the other thing is we have to be cautious about is these variants, right? So if these variants pop up, then we may have to have a sort of booster or additional vaccine that would be that, that could be once a year with something like that. But hopefully, we never know for certain, right? So in the great flu pandemic of 1918, it was horrible for like a year and a half, 2 years, and then it just went away. Right? There were no vaccines, and it just went away. And we don't know why it went away. We'd like to hope this would do the same thing, but we don't know. So right now, we're trying to do everything we can. Hopefully, particularly if more and more people are immune to it, then the vaccine doesn't sort of have an opportunity to live and develop new variants, and that may help it go away. So we'll see.
You good to take a few more, Dr. Norris?
Sure.
Okay, great. So this one is, what happens if we do not wait the 90 days to get the vaccine after testing positive for COVID?
Okay, so we don't have to wait 90 days. Actually, it's recommended that we get the vaccine within 90 days. Right, so it's preferred to get it before. If it happens to be longer than 90 days, right? Because some people may have gotten COVID infection last August, right? And now you're coming up and it's like people are telling you you're not on the list, you're not eligible, et cetera, et cetera. So it's way more than 90 days. So there's nothing like bad about it per se. It's just you wouldn't know for certain if you're still protected from getting infected again during that period after it goes past 90 days. So it's not a bad thing per se, like something bad's going to happen to you, but it's just that your protection from COVID-19 is probably dwindling after 90 days. And so what we don't want you to do is be counting on, oh, I've had COVID, I'm immune, nothing's going to happen to me. So that we don't want you to do.
All right, so as we begin to run out of time a little bit, we're going to try to focus more on the questions that address issues that have not come up yet in the discussion. Some of these questions covered some things that had already been mentioned previously, so we're going to try to focus in on some questions here as we're running out of time. Let's see. So if we show symptoms after the vaccine, is it recommended we stay away from people? Like, can we get other people sick due to our symptoms?
Great question. So no, you can't get other people sick because you have symptoms. Those symptoms are because of the immune response that's happening inside your body, and it's not something that you can give to somebody else. What I would recommend to everybody, and what I did is right after I got my vaccine, I started taking Tylenol. And so I took Tylenol, like 2 Tylenol every 6 to 8 hours for 2 days. Because I feel, why wait till I start getting some symptoms and start taking it? It may be too late then, right? So I started taking it right away, and maybe that helped me. I don't know, but I took it, and so you can take Tylenol, you can take Advil, something like that, just as a prevention. It's not recommended to take it before you get your vaccine, but take it right after you get your vaccine. That's my recommendation.
Dr. Norris, I believe you may have addressed this, but just to be sure, how long is it anticipated that protection from the vaccine will last?
Yeah. So we still don't know, but it appears that it should be good at least for a year. But it looks like we may be lucky and it may be good for as long as 2 or 3 years. So I think that's all of our hope. The longer it lasts, unless we have to take any vaccines, is better, right? So it's nice that we have some medicines, but none of us want to take any medicines, right? For anything, unless we absolutely have to. So we'll wait. We will find out and see how long it lasts, but we don't know for certain. But we're thinking at least a year. And but I'm hopeful. I'm much more hopeful now that it could last 2 or 3 years. But as I mentioned before, depending on these new variants, we may have to think about whether or not we need to take then a different modified vaccine in between. But at least right now, the 3 vaccines that are approved, the Pfizer, Moderna, and J&J, are doing a great job of preventing severe COVID-19, even with the variants. And I think that's really what we want to prevent, severe COVID-19, right? I don't think everybody would be excited about going to take a vaccine just to not feel like they had a cold, right? Everybody would be taking a vaccine because they either don't want to be hospitalized or give it to some family member who could become hospitalized or die. Right? So that's why the vaccine is something that people are thinking about and public health has been promoting, because we really want to prevent those things from happening.
And then there's a request for clarification on a CDC position. It says, according to CDC, only if you had COVID and were treated with monoclonal antibodies or convalescent plasma, you should wait 90 days before getting a COVID-19 vaccine. Can you please clarify?
Great question. So we didn't talk about that, and this is a great question. So some people may have received monoclonal antibodies or convalescent plasma, right? So those were some other studies. And so if people, particularly if people are hospitalized or they were at high risk and they were really feeling sick at home, then there were studies you could get into where you could get these monoclonal antibodies that they would give you to try to give you antibodies to be able to combat the COVID infection, or to give you plasma from someone who already had the infection because they would have antibodies. And so if they could get your antibodies like a blood transfusion, but this transfusion is to give you the COVID antibodies. So there you should have some level of antibodies. Now those have, how well those work, they haven't worked as well as we had hoped. So it tends to make the duration of the COVID infection shorter, but it hasn't been the type of like great success we had hoped for. But because now there are these antibodies floating around in your body from either getting this antibody infusion or this convalescent plasma infusion, it's been recommended to then wait till after 90 days before you get the COVID vaccine. Because now there's lots of, now you have both infection and antibodies, and you have these infusions, and there's lots of things going on in the body. And so they feel it's better to wait, give your body a few months to sort of come back into balance before you then get the COVID vaccine. See.
All right, so we have another question here. What if you miss your second dose and a few months go by? What's the recommendation?
That's a good question. I'm not actually sure. I think it's, I'll have to check into it. My guess would be they would still just get it when you can get it. It's my sense is it's better than not getting it. We don't have a lot of data of what to do if it's outside of sort of how the trial is done. The other question I hear a lot is it okay if I had one vaccine before? So the Moderna and the Pfizer are 2 shots. If I had Moderna the first time, can I get Pfizer the second time, or the other way around? And again, we don't recommend it. We usually don't want to, that the study wasn't done that way. And we'd be a little concerned, even though they sort of work the same, we don't know what might happen with side effects or something, right? If you're taking antibiotics for an infection, we usually don't want people switching and taking a different brand of a different type of antibiotic. So we want you to, keep with the same vaccine that you were taking, right? If you had, we wouldn't want you to go out the house. You may have 2 pairs of shoes. We don't want you to go out with one different shoe from each pair, right? Now, the vaccine is a little more serious than that, right? So it's okay. It may look a little weird if you have one shoe from each pair, but that's not what we want you to do. So we want you to have the same vaccine both times. But try your best to get that second vaccine. If you've passed it, get it as close as possible. Now, you will still have some protection if you only got the one, right? So we don't know how much, but you'll still have some protection. So that's, we'd like you to have more protection, but you will still have some protection from one.
Thank you so much, Dr. Norris. I see that we're a little bit after 1 o'clock. I do want to make a quick note. There was a question that came in that I think was more specifically geared towards the mission administration. It was, what is LAMC doing to accommodate and prioritize the scheduling of testing for its students? And our response right now is that we don't have any information yet as to when students or the general population will be vaccinated that does not currently fall into the categories notated by the county. As soon as we have this information, we will disseminate it quickly. So just wanted to give you all that heads up. I want to take a moment to just thank Dr. Norris for his incredible expertise and answering so many of our questions and providing such a great presentation. With your okay, Dr. Norris, there's a bunch of questions. Perhaps we can gather them and maybe work with you on that and then get responses out to folks. That would be fantastic.
Yeah,
thank you. I want to respect everyone's time. So just want to wish you all be safe and healthy. And do your vaccination. Dr. Norris, I think, made a very convincing case. Do your vaccination.
Yeah. And in the meantime, the 3 W's: wear your mask, wash your hands, watch your distance. Okay.
Thank you so much.
All right.
Thank you, everyone.
Take care, everybody. Be well.